The COVID-19 emergency officially ended yesterday in the United States. And with this change, local nurses find themselves in a period of transition.
13 WREX's Emily McMinn spoke with local nurses about this change and the effects it has on their careers daily.
With the emergency officially ended, nurses truly see a return to the past.
Those ending are actually returning to what we know best and do best. So we do follow those regulations and keep our eye upon what we need to do to stay healthy as an organization and keep our patients safe.
However, the pandemic did not come without its share of changes, shaking up the scheduling and departments at local hospitals.
There was a lot of people that decided they were going to go into different facets of nursing during that COVID, where they it was a lot. It was a lot to take in, and being able to take care of all these patients and the influx of them.
One main improvement from March 2020, the information available about COVID-19. But the changes it brought will forever be a factor.
So how we use PPE, how we address patients, how we administer medications, those are just now part of our normal routine and practice. So it is a return to normal, but with an additional virus that we didn't expect and didn't see coming.
That statement is echoed by an emergency room nurse who found herself treating COVID-positive patients from the very beginning. 3 years later, though, she says the staff is more than prepared to treat those who find themselves experiencing symptoms.
During the beginning of COVID, we didn't know anything about it. Nobody was kind of telling us, nobody really knew. And now that we've had, we're 2 years into it, we have a better understanding of what COVID is, how we need to deal with COVID, how to handle these patients. We're still seeing it every day, not as much as we did, but yeah, it's a better handle on the patients now.
Well, that was Emily McMinn reporting. The COVID-19 pandemic was officially declared an emergency just over 3 years ago, back on March 13th of 2020.